Facelift's a term that's widely used for a general procedure that results in facial rejuvenation. It can mean a lot of things to a lot of different people and a lot of different things to a lot of different surgeons. There are a number of types of facelifts, all of which also have different names amongst different surgeons, so it's very, very confusing for the people out there to really understand what a particular practitioner is talking about. With facial aging, there are essentially three things. So there's the skin and the way that ages, there's the underlying tissues which sort of fall with gravity, and then there's the volume of the face, which tends to decrease in many parts of the face and increase in some others. Facelifting is best at addressing the falling of the face. So the muscles and ligaments that have loosened off, just like any other part of the body where the muscles and ligaments loosen a little bit and become a bit more lax, so do the muscles and ligaments of the face. And this allows the face to drop, developing jowls, deepening of the nasolabial fold, or that fold between the cheek and the lip complex, and also aging of the neck. So the neck tissues become more lax, some of the muscles in the neck become more lax, and we can see sort of a poor definition of the neck and these bands, or what we call platysmal bands in the neck. Facelift goes a long way to repositioning all those muscles and ligaments. When it's done in a procedure called a deep plane facelift, we literally go beneath all these muscles and ligaments, lift them back into their rejuvenated position, and then just with the skin on top is just laid back. So there's no tension in the skin, it's literally just rejuvenating all the structures underneath the skin, putting them back where they were in youth, and allowing the skin to redrape. That gives the most natural appearance. Very rarely will the face be done without some sort of neck lifting. When one's lifting the underlying structures of the face, the muscles and ligaments of the face, they're attached to the muscles and ligaments of the neck. So lifting those, by definition, will lift some of the muscles and ligaments of the neck. So you will obtain improvement in the neck regardless. There are additional things that one can do if the neck is particularly an issue, and we can add those in to get an even better neck lifting result. The corollary, so the other way around, if people are looking for a neck lift, really the best way to lift the neck is also to lift the face. One can do a pure neck lift, but what we want to do is lift everything back up. So we really have to go into the face at least a little bit to really properly reposition the structures of the neck. Again, there are many terms for this: a mini facelift, a short scar facelift, a max lift. All of these, the premise of these are that it involves a shorter scar, which really just runs in front of the ear and into the hairline a little. It does limit the amount that one can rejuvenate the neck, but it's a reasonable procedure for the much younger patient who just has minimal jowling and minimal neck aging. They just really want to freshen up. Both types of facelifts, the recovery is essentially 2 weeks. Okay? Any bruising that occurs will sort of take 10 to 14 days to go away. So what I tell my patients is if they have a short scar facelift, that might be sort of 2 weeks or a little bit under to recover, to be presentable. With a more comprehensive facelift, that might be 2 weeks and a bit. So if they can get 3 weeks, that's fantastic. But it really just depends on the patient. Some people with a very comprehensive facelift will look great at 2 weeks. Some people will take a little bit longer. Yeah, the things that I wish I could tell patients, they're not going to look freakish, they're not going to look abnormal, it's going to be very natural. Overall, it's a very safe procedure. All surgery has some risks, but it's a very safe procedure. It's not a very painful procedure. The recovery is really just being gentle for a couple of weeks. There's not much more to do than that. And that it's one of those procedures where almost universally people come out happy, and so that's a very good thing for me, because if I can do something and someone comes in a little bit nervous and comes out happier, after they've gone through a procedure, then that's wonderful.